Hormones are the body's chemical messengers and control many of the body's major processes, including your metabolism and reproductive system. But if you have an imbalance, the smallest offset can cause large side effects throughout the whole body.
So when we talk about hormone balancing from a naturopathic perspective, we're always going to look at the same types of things for men and women. We look at progesterone and estrogen. We look at testosterone. We also look at other things like adrenal hormones, cortisol, DHEA. In women that are looking to help with fertility, we look at FSH and LH. And then in both men and women, we're looking at thyroid function. So looking at the entire thyroid panel, TSH, T4, and T3.
According to the physicians, the majority of their clients are coming in with an imbalance and are looking at somewhat of a hormonal dysregulation in one capacity or another, including low energy, thyroid issues, cancer, or sleep disruptions, and possibly even infertility.
So most patients that come to our clinic or to see a naturopath or even a family doctor know that something is wrong. They usually present with some type of a symptom. Very rarely do we see somebody coming in and saying, I'm very healthy and I like to optimize my hormone health. Typically, someone comes in, they are symptomatic, whether it's premenstrual symptoms like headaches or menstrual cramping, or it's a woman who's going through some hot flashes or insomnia due to menopause. We then take those symptoms into consideration. We, at that point, would consider doing some tests as well and really going over the patient's medical history to dig really deep to see what the foundational problems are. We as naturopaths really focus on root cause. So yes, she may or he may have symptoms, but I want to address what's the underlying cause.
And when it comes to fertility struggles, hormonal imbalances play a nasty role in the conception process in both men and women.
So anyone that is using different types of hormones for the purpose of gaining lean body mass or changing body composition needs to be really careful in terms of monitoring those with a medical doctor or other specialist in order to avoid disruption of hormones down that steroidogenic pathway. So we can look at changes in things like hormones like cortisol and DHEA. We can also look in men at an establishment or an increase in the amount of estrogen that they produce, and this in turn can impact their fertility.
There are many factors that can offset hormones, such as environment or stress levels. But whatever the root cause might be, the first step is to learn what exactly is off.
So there are many tests that we can perform to see exactly what's happening with a patient's hormonal health status. We may seek out their physician's support in looking at serum or blood testing. We may look at salivary testing. So these are wonderful, easy at-home kits that the patient can do themselves. So we will do urine testing, and that gives us an idea of what's going on with their hormonal health throughout their month. If we're looking at female hormone health, we will do a month-long assessment following the menstrual cycle. If we're looking at male health, we'll do it on a one day.
Although there's no cure to imbalances, with the right set of eyes and a laid-out plan, there are treatment options available, no matter what stage of life you're entering.
Naturopaths are able to prescribe certain bioidentical hormones, so should we need to use that, we have access to those. However, I believe most naturopathic doctors, including ourselves here, we focus, as I've mentioned, on the foundation. So we have to figure out, why is the hormones out of balance? Is it mental emotional stress? Is it environmental stress? Is it digestive stress? And treat that. And you may use herbs, you may use certain nutraceuticals, we may use IV therapy for those purposes. And I think hormones and replacing hormones is sort of on our last agenda.
With the right balance of nutrition, healthy lifestyle, and getting those hormones in place, there is a way for you to look and feel your best, and also a light at the end of the tunnel for those fertility struggles. For Halton News, I'm Kristen Demeny.